Dr. Bill Adams here. This is episode 82 of No Spin Live. Today we're going to cover breast implant removal warnings and a reality TV zealot calls plastic surgery barbaric. And we've got two incredible international experts to tell us what the deal is. We got Dr. Jason Posner from Boca Raton, JP, and
85 degrees, Boca Raton, Florida.
And not from 85 degrees, Dr. Mark Epstein from Long Island in New York. Mark, it's not 85 there, is it?
No, it's not, and we had a storm advisory today, so It's getting cold.
All right, well, listen, let's get into this. So this story came from the Korean Society, and they were basically giving a warning to the public about kind of haphazard breast implant removal with textured implants. And this is something that warrants constant discussion because there's a lot of misinformation out there. So Jason, lead us off.
You know, we've been through this many times on PSC No Spin Live, right? Ever since the ALCL stuff broke years ago, we were way ahead of the curve talking about this. So there are very good data now. There's recommendations from the FDA. There's recommendations from ASAPS and ASPS and all the American societies. And those recommendations are, don't put any more of these highly textured implants in. They've been pulled from the shelves, but if you have them in and you're not having any problems, leave them alone, because the trauma from taking them out is higher risk than the trauma from potential issues of leaving them in. So the Koreans have followed suit with our FDA and Canadian guidelines, which is basically don't touch them if you're not having a problem. That being said, we looked at one of the real self questions the other day. One of the idiot doctors on there was talking about how this patient with textured implants needed to have them removed, needed to have the capsule removed and change her implants out immediately. We actually banged this guy. We were going to set him up for ethics violations. Bill saw that. I sent you that clip. It was crazy. It was like, this is a guy who is not following FDA recommendations and just a charlatan looking to get business. Also
stems from just kind of nebulous media coverage on this, where patients see something on TV, they read it, and they get the message, or the message coming across is it's an emergent thing to have the implants removed. So what do you think?
I've got a couple years on both of you guys, and I remember being a resident during the 1991 breast implant crisis. And you know the saying, those who don't learn about the past to live to relive it again. That's exactly what's happening. Back then you had a bunch of jerks who were putting themselves out there as experts in explantation, and they were pulling out implants from perfectly healthy breasts, and now we're seeing the same thing, and people are taking advantage of the situation, putting themselves out there as experts in this and trying to get women to have surgery that they don't need. You know, I'll put my plastic surgeon hat aside and I'll put on my father's hat. My older daughter has textured implants, and we've had this discussion, and she's doing well, she's happy, and she's perfectly fine with surveillance, and that's what we've decided to do. If she changes, if she wants to change, I'll make it happen, but I'm certainly not encouraging her to undergo the knife at this time. You know, it's interesting. We always use that line in my office. I always talk about our family members, and I talk about what the staff has. And you know what? The staff follows those guidelines. No one jumps to doing anything stupid in the office. When the patients are scared about something, my staff really calms them down. They say, well, I have these implants. I'm not going to do anything.
Yeah, I think that's good information. I've got two family members with textured implants, and they're still in, and they're probably going to be in for many years, because the risk, as you said, Jason, the risk of having surgery, just having surgery, is far greater than the risk of ALCL, which particularly for certain types of texture implants is minuscule. So anyway, let's move on to this other story. This is out of one of the more popular reality TV shows, Botched, and one of the guys on there, he's like says because we use sutures and things like that plastic surgery is barbaric. So what do you think about that, Jason?
You know, it's interesting because I've been known to call liposuction barbaric in the past, and someone came up to me and said, one of the plastic surgeons said, don't say that. You know, so it's like, it's not barbaric, but I wish we had better. I mean, he's just like, this is typical of all media garbage. You know, you take something and you try to blow it up to get some media coverage, and I think that's all this is. You know, I wish we had something better than sutures to suture people. Dr. Monty Eves, our buddy in Atlanta, is working on on a new wound closure system that's amazing. Larry Bass, who we all know in New York, in his training, he was working on laser welding, didn't get anywhere with it. So we've been looking at things. I did a case with Barry in my office 2 weeks ago. We got trained on the temperature, and he was using this Cynosure device to cut. It was bloodless. So, I mean, we definitely test these advances, but I don't think they're quite there yet. I don't think we have better alternatives for everything than sutures. I don't think we have any better alternatives than a knife right now. Cauteries, we've been using cauteries for 100 years now. We're starting to work on some upgrades to those things, but you know, it's evolution. And in 10 years, we may not be doing the same things we're doing now. We have a lot of newfangled things that's my interest, is all these new technologies and how we can kind of replace ourselves. But I don't call it barbaric. I just call it evolution. And there's some things that work better than others.
What do you think, Mark?
Yeah, I think, pretty much I agree with everything Jason said. Evolution occurs at its own rate. I remember as a kid watching Star Trek, and you see Lieutenant Uhura with that little thing in her ear, but it turned out to be, 30, 40 years before Bose came out with one of the first Bluetooth ear things. Maybe one day we will have something that will be a better wound closure device. Maybe it will be what Monty Eves is working on, maybe not. But everything evolves at its own rate, and some things will advance faster than others. But to take something that does work and call it barbaric just because some other technology is more advanced or advances at a faster rate is absolutely absurd.
It's interesting. So, we talked about this probably about 10 years ago, cutting with a laser. Which would you rather do, cut with a laser or cut with a knife? Okay? Which sounds cooler to you? Cut with a laser, right? Turned out that the laser caused more damage than a knife did. So we were looking at obsidian blades for a while because we thought the obsidian blades caused a little less trauma. So Barry DiBernardo, our close friend, he has some electron micrographs of cutting with this temperature device. And you're looking at these collagen fibers, and you see that this one device disrupts the collagen fibers less than the knife does. So, I mean, it's pretty cool when we can use modern day imaging techniques to actually see the damage with one technology or another technology. And we'll see whether it's cost effective or not.
I think the guy's choice of words is poor. I mean, maybe at some point, I think you guys are right. Maybe it will be obsolete, but it's not necessarily barbaric. Barbaric's like a...
I think barbaric is...
Pull out the Webster Dictionary thesaurus, dude. I mean, come on.
I mean, the way we used to do surgery without anesthesia, that's probably barbaric. I think right now we're in controlled environments that are not barbaric at all.
I think you can only call something barbaric when you have different ways to do something, and one available, accepted way is clearly better than another. Back in the days when you didn't have anesthesia and you give someone a bullet to bite on to do a field amputation, that wasn't barbaric because there was no other alternative, but certainly by today's standards it is. Well, if there is no better wound closure device, no better way to incise skin, then what we're doing is still the gold standard, and it's not barbaric because there is nothing else to compare it to.
Yeah. Mark, interesting. Talk about liposuction technology. Like, before we started putting in tumescent fluid prior to liposuction, you stuck this tube in, you caused a lot of bleeding and contour defects. I would consider that barbaric compared to what we do now using fluid to decrease the bleeding and smaller cannulas. I mean, that's a huge, that would be my definition of that.
Yeah, when I was a resident, we were doing bloody liposuction, and we were debulking large areas of fat, and contour was, barely an issue. And now we're doing etching, and if a patient has the slightest little contour irregularity, then we're taking them back and taking out small amounts of fat. We've refined liposuction to liposculpture.
And we both like a lot of technology to help, enhance the technique and tighten the skin. So we do quite a bit of that in both of our practices.
Definitely.
All right, so I think we're all in agreement. No Spin Live is officially calling botched. Come on, man. Great stuff, guys. So if you want to see more of this, you can see it on the plasticsurgerychannel.com.